Assalamualaikum warahmatullahi wabarakatuh. My name is Retno Wulan Seroja. I will bring you the research journal this time. And the title of the journal is The Levels of Depression, Anxiety, Acceptance of Illness, and Medication Adherence in Patients with Multiple Sclerosis with Descriptive and Correlational Study. Next, from Introduction. According to the data from Multiple Sclerosis International Federation, or MSCF, over 2 million people in the world suffer from multiple sclerosis or MS. You can take a look on the picture. A disease can cause the myelination and degeneration of the central nervous system or CNS. MS patients live on average 7 years less than people in the general population. However, the rapid development of both new treatment strategies and the improvement of care can increase this life expectancy. Next, the first-line drugs for MS. Currently, the first-line drugs for MS include interferon beta 1A, it's Avonex and Rebif. Avonex, which is injected intramuscularly once a week, and Rebif, which is injected subcutaneously 3 times a week, and interferon beta 1B, such as betaferon and extavia, which are injected subcutaneously every other day. From glatiramer acetate is a Copaxone, which is injected subcutaneously every day or 3 times a week. Dimethyl fumarate is Tecfidera, which is taken orally twice a day, and triflunomide from Aubugil, which is taken orally once a day. Next is about the problem. However, a prerequisite for achieving the result understood to stop the progression of the disease, reduce the number of relapses, and reduce the number of hospitalization is that the patient must follow the prescribed drug regimen. Unfortunately, current studies have shown that the percentage of MS patients who do not adhere to recommended treatment range from 7% to as much as 59%. Patients diagnosed with depression or anxiety are 5 times more likely to have problems with following a prescribed drug regimen. People who accept their own illness look more confidently to the future, have more hope for better health, and experience fewer negative emotions related to the disease. So, it's extremely important to detect early symptoms that might indicate depression or anxiety. Next is about the aim. The aim of the study was to assess the impact of mood disorder, anxiety disorder, and the acceptance of illness on MS patient adherence to recommended immunomodulation drug treatment regimen. After that is about material and methods. On study design and participant, the investigator used a cross-sectional descriptive correlational study design with a questionnaire based on survey. All participants were recruited from patients with MS treated at 4 leading neurological centers in Bengkulu, Poland. The study involved 166 women and 60 men aged between 19 and 94 years and treated with first-line drugs such as Avonex, betaferon, Copaxone, Rebif, extavia, and Tecfidera. It was demonstrated that 23.5% of respondents don't follow recommended treatments. This is patients with identified as non-adherent or non-ADH if they missed 1 or more doses in the 28 days prior to completing the survey. And the slide is about research instruments. The data collection and measurement tools used in this study included an author-designed questionnaire or ADQ and 4 standardized questionnaires. This is the Beck Depression Inventory, the Hospital Anxiety and Depression Scale Modified Version, the acceptance of illness scale, and the Polish version of Multiple Sclerosis Treatment Adherence Questionnaire. For semi-structured and self-administered questionnaire designed by the author was an original and under-designed survey for social demographic data collection, such as age, sex, place of residence, educational, marital status, and financial status, and a duration of illness. After that is about research instrument. For research instruments, statistical analysis was performed using statistical software version 13.0 under the license of Bengkulu Medical University of Poland. For the measurable variable, the arithmetic mean, median, standard deviation or SD, and extreme values or mean and max were calculated. For non-measurable variables, our percentage were calculated. All quantitative variables were tested using the Shapiro milk test to determine the type of distribution. The non-parametric mean whiteness was used to compare the result between adherent or ADH versus non-adherent or non-ADH for continuous variable, and the chi-square root test was used for categorical data. And after that is about the result. I think this is the main point of the journal. Analysis of the data from HIDSM questionnaire showed that 41% of respondents have experienced symptoms of anxiety, 28% have reported symptoms of depression, and 63% have had symptoms of irritation or aggression. An analysis of the data from HES questionnaire showed that the average level of illness acceptance is 28.3 points, and only 16% of patients don't accept their own illness in any way. It was also demonstrated that the patients from the ADH group significantly more often accept their illness if they are satisfied with the current treatment, whereas this relationship was not observed on the non-ADH patient. But in both groups, however, it was observed that this satisfaction with treatment reduced the occurrence of anxiety and depression symptoms. And this slide is about a discussion. The study showed that non-ADH patients who experience more symptoms of depression and anxiety more often indicate the presence of barrier to their ability to follow prescribed drug regimen. They also more often complain about the occurrence of side effects. And for clinical implication, the emotional state of a patient is an important factor that can both positively and negatively affect their adherence and their resulting prognosis. So, healthcare provider would take care of MS patients undergoing immunomodulatory treatment should constantly monitor their emotional condition. And in case of any alarm signal, they should recommend consultation with a psychologist or psychiatrist. Healthcare providers should also offer a wide range of support, both information and emotional, taking each other individual MS patients' situation into account. Next, we meet the last slide about the conclusion. So the conclusion is anxiety, depression, irritability, and aggression have a significant negative effect on MS patient adherence to recommended treatment. However, illness acceptance can positively offset this. Okay, I think this is enough. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.